Now, the COVID-19 pandemic exposed Africa's vaccine vulnerability. Leaders from the continent, the pharmaceutical industry, and international healthcare were in Paris on Thursday for a summit on how to prepare Africa to eventually make the shots required to meet its own needs. Our Aline Bottin headed out for us.
I'm here in the heart of Paris at the French Foreign Affairs Ministry, where several African heads of states, including from Botswana, Ghana, Rwanda and Senegal, met on Wednesday for the Global Forum on Vaccine Sovereignty and Innovation. Moussa Faki, the chairperson of the African Union Commission, also made an appearance, reflecting just how important these conversations are for the continent. As evidenced by Africa's scramble for timely access to Covid-19 inoculations, the continent's reliance on imported doses has to change. Senegal's President Bassirou Diomaye Faye and Rwandan leader Paul Kagame emphasized the cost of these global disparities in their speeches here.
According to the UNICEF report of 2021, 23 million children didn't receive the basic vaccines necessary for their normal development at the height of the pandemic.
So the African Union is working with Gavi, the Vaccine Alliance, on a push to drastically ramp up Africa's capacity to produce vaccines. Gavi set out a 5-year roadmap, which it estimates it will need around $9 billion to achieve. This includes expanding stockpiles of vaccines to cope with expected increases in disease outbreaks. Also in the spotlight was the launch of the African Vaccine Manufacturing Accelerator, AVMA, one of the mechanisms set up to finance the development of a sustainable African vaccine manufacturing ecosystem. Today, 20% of the world's population is in Africa, but its vaccine industry only provides around 0.1% of global supplies. The African Union seeks to manufacture at least 60% of the total vaccine doses required on the continent by 2040.